Mitchell's Plain Day Hospital has one of the highest burden of patients in the city, and you all know, have seen the changes that has occurred in the facility over a period of time, and we want to keep making it better and better, because it's not just about the facility, but it's about making it easy for you to be at the facility, making it easy for you to carry on your life with minimum interruptions as possible. There is a lot of people who do not collect medicines, and when you don't collect medicines, first, we don't know what's happening, we don't know if you're getting better, but it's costing a lot that you don't collect the medicine, and that's what we know. But if you don't take the medicine and you get sick or worse, and you end up in hospital, that's you off work, you away from your family, and then also a lot more cost, which could have been used for other things that we need. So we just want to understand each other better in terms of chronic diseases, so that we see how to make our services easier for you to access, and then we see if there's something that is of importance to you that we have been overlooked. Thank you very much. Dr. David from the facilities here, and probably wants.
Hi, I'm Dr. Neil David. I'm the family physician at Mitchell's Plain Community Health Centre. Okay, well, the Community Health Centre provides a wide range of primary healthcare interventions. We have a 24-hour trauma unit, we have an outpatients department, and a maternity obstetric unit, and then we have an ARV clinic and a chronic club for the management of chronic diseases of lifestyle. So the chronic club is responsible for the management of patients with chronic diseases of lifestyle. The 5 main chronic diseases of lifestyle that we've identified and that we manage on a regular basis are diabetes, hypertension, asthma, chronic obstructive airways disease, and epilepsy. Very often there's an overlap between these chronic conditions, and so patients have what we call comorbidities, or more than one disease entity that we have to manage. It can be a fairly complex management task, and we've tried at the Mitchell's Plain CHC to restructure the management process to account for the complexities involved, and to try and allow patients more convenience and less hassle. We have one of the biggest chronic clubs for chronic disease of lifestyle, or CDLs. Chronic disease of lifestyle is quite a mouthful, so we usually abbreviate that to when we talk about CDLs. So we have one of the biggest chronic clubs for CDLs in the province, the biggest that we know of, where we manage in excess of 20,000 patients. Logistically, that's a very difficult task to undertake. We also need to distribute about 23,500 pre-packed medication parcels every month. And in order to do that, we have needed to devise a system where patients can enter the facility, be seen, have their observations done, be issued medication, and be issued their follow-up appointments within a time frame which is acceptable to the patient. At this facility, we've been able to actually get that time frame down to a period of 2 hours, which is actually a benchmark for the public sector. It's something that's never been done before, and we've worked very hard to achieve that goal. So we've understood that the system that existed was really putting a lot of strain on the community and on patients. And we see it as a key priority to change the system and to, we understand that with chronic illness, chronic disease, patients have to be on medication forever. It's not something that comes to an end next week. It's not like taking an antibiotic. And that's a big commitment. So the patient needs to make a big commitment in their lives. The patient needs to make a big commitment to us to take that medication and to collect their parcels. But we also need to make a big commitment to you. And that commitment has to be, we've got to make it reasonably easy for you to be a diabetic patient or a hypertension patient or a asthma patient. Because if we don't make that transition, if we don't make it easy for you to be that patient, you will stop coming to the clinic. And the only time we'll see you is where? In trauma. And that's what we want to avoid. The best way to manage a patient with a chronic illness is to maintain that patient's health. Everybody sitting in this hall today is actually, yes, you've got diabetes, you've got hypertension, but you're not ill. You're not lying in trauma. And that's thanks to the medication that you take. But we are confused sometimes because we see all these parcels that are meant to be picked up and they're not picked up. And we don't know what we've done wrong. We've paid for that medication, it's there waiting, and many times we see a patient in the future and it's not that that patient was sick or anything, it's just that that patient didn't collect. Sometimes they don't, they just say they had enough medication. We also want to know that, if that's the case, are we providing too much medication? We don't know. But one of the reasons we've got you here today is we want to have, this is called a Q&A session. Q&A, question and answer. You ask the questions and we'll try and provide the answers. And it's only through this process of Q&A that we will maybe get to know each other a little bit better. And the system that we've introduced now, the latest innovation, I presume all of you are registered on the SMS system, which is how you got notice of this meeting, is I think that's a key link. When you leave the clinic, we do still have contact with you. How? With those things in your pockets. You're always connected. So I will, those are just the introductory remarks, as I say, but just echoing my colleagues' comments. As you know, Dr. Anaso is partnering with us in this journey. We look forward to a long, ongoing relationship, building this process up, and also spreading it also to our other facilities in the rest of the substructure, possibly even in the rest of Cape Town eventually, because I think that this could really be, could show the rest of Cape Town how valuable it is to have this kind of connection, this service that's ongoing between the doctor and the patient, or between not the doctor, between the facility and the patient. Because it's not always what goes on your visit day that counts, it's what goes on between your visit days that counts.
When you attend the doctor, your date, you don't have to stand in a line. You don't have to go to any window. You go straight to the chronic club. And that is where the nurse will give you your folder and say, go to the doctor next. I was out there within an hour of my date. So there's not a lot of people that know these things.
Ja, goedemorgen, mijn naam is Kassim Beste. Diezelfde het gebeur met mij. Ik heb 2 jaar geleden was ik ook een farmerpres. Ik heb die dokter gezegd, die farmerpres is een probleem. Hij heeft mijn ogen zoiets en iets anders. Wat ik weer gaan... Wat ek weer gaan, toe sit hulle my by Annapol. Wat ek weer gaan by die chemist, toe sê hulle weer vir my nie, according to government regulations, ek kan nie met duipil gee nie, toe gee hulle my weer Famapres. Ek was gister weer by die dokter, want ek was 2 maande terug daar, toe sê hulle vir my, ek moet 5 o'clock kom om 'n dokter kon sien. Want die diabetes, die sisters kan nie vir jou niks opskryf nie. Gister het daar gekom, something to 5. Ek het weer aan 3 o'clock. Ek het die distriksuster gevra van goed, hulle het vir my gesê, ek moet 'n dokter voorsien, laat hy vir my brief kan opskryf, laat ek gaan eers terug hier toe, because ek het cataracts. Die vrou het niks gedoen nie. Dieselfde wat ek kan sê, ek het my enkel gebreek, ek het pyn aan my knie, sy het niks geworry nie. Nou ek weet nie, wat is hulle purpose daar nie? Want hulle serve niks purpose, as hulle nie purpose serve, moet hulle remove word. Want hulle doen niks free service, hulle word betaal. Niemand by die daghospitaal doen 'n free service nie. Niemand doen voluntary work nie, hulle word betaal. So wat my verlang is net, hulle moet die diaper moet hulle remove, because hy's 'n nadeel. That's all what the bullshit.
Okay. Doctor, are we going to have answers on the questions, or are we just going to continue? Let's continue. Okay, who's next, please?
My name is Kawach Hefter. I just want to say thank you for the changes that has been made at the day hospital. But at the club, there are hundreds of people that has an appointment for the same time. So when you go to the club room, even though your folder is already there, people still have to stand in a line to go. And there's only 2 sisters at the club that assist the people to take the blood pressure, take the sugar levels, take the blood levels and whatever they do there. But all the other people still has to stand in a line outside to get into the club room. And there are old people that stand there that with sticks and whatever, they can't even stand up straight there, but they have to stand in that line. And I think that is very unfair towards the people. Why can't they put more sisters there to assist the people with that and let the process go quicker?
Ons word gesien as 'n las in die samelewing. Jy weet, ek vat my pa 'n Vrydag na die daghospitaal en 'n suster ondersoek hom en sy sê nee, hy bekeer niks. Maar hy het 'n verskriklike pyn aan sy linkerkant. Sy gee pilletjies, kom by die huis, hy kla nog altyd. Die Sondagmôre vat ek hom weer daghospitaal toe, na emergency toe. Toe ek saam met die suster praat, toe sê sy vir my, almal as emergency en ons moet wag. En terwyl ek opdring, kom die dokter net te sê, okay, hy moet maar daar gaan lê. En ek kan maar huis toe gaan. Ek praat saam met my pa en ek bid vir hom. 10 minute wat ek by die huis kom, toe bel hulle my, hy is oorlede. Jy weet, dit is tragies om te aanskou wat by die daghospitale gebeur saam met ons ou mense. Ek wil graag 'n beroep doen op almal die in mag en krag is om iets daaraan te doen. Baie dankie.
Good afternoon, my name is John. I think what actually is, I heard what this gentleman says now, and it's a tragic, it's really a tragic, because, you know, to lose somebody, I mean, it's your father or your mother, due to the day hospital, I mean, it's not on me. And we must stand up now for our rights, and I think it's time now that we must do something about this day hospital, because many a times I came there to the day hospital and they tell me that they are short of staff. And that is not on me. Last month, the 29th, I went through there to the day hospital for my medication, and I see that the glycoside tablets is not in my packet, and it don't state on the packet that they are sort of glycoside or sugar tablets. There's always a shortages of tablets in the day hospital, and you sit there the whole day, man, waiting for medication. Man. I mean, that is not fair. Man. People, we are suffering of a chronic illness. And I think it's by time now that we must do something about it, man. people there by the day hospital, I think they must, as the gentleman said, that they must get other people there to work by the day hospital. Thank you very much.
I had a problem. She sent me for the ECG, came back, she gave me pyridoxine. When I again went to a club, I saw another CNP and I had the same problem, but she didn't do anything about it. So what do we do in that case? Because now I must wait another 6 months to see the doctor.
Toe vat hulle vir my deur na emergencies toe. Toe ek nou daar kom, toe sien ek my ma kan amper nie asemhaal nie. En na seker meer as 3 ure, as dit nie langer is, het ek gewag. Want hulle sê hulle moet eers 'n ambulance kry om vir my na Joseph se hospitaal te neem. En terwyl die ambulance kom, toe ek was so bereid want ek sien toe my ma kan dit nie maak nie. En toe ons nou terugkom, toe is dit nou 'n African ene wat nou kom, maar daar is nie wiele aan die reisstoel nie. My ma het so gesleep tot voor en sy sê vir my, sy het 'n groot pier. En die meisie sê vir my, it's not my job, you can take it to the toilet. Jy weet, ek was so teleurgestel, want ek vat net so, dit is ons hulle werk om vir ons te help. En jy weet, terwyl sy ingelaai word by die dinges, toe moet ek en my skoonseun self haar insit by die ambulance. Daar is werk, die werk is daar, maar hulle het nie vir ons gehelp nie. En terwyl die man wat daar op die ambulance werk, toe hy nou weer oor my ma gaan, toe sê, who sent you back? Ek sê, die dokter het vir ons teruggestuur, want sy moet nou ambulance vat na Jooste toe. Jy weet, was nog eens 10 minute nie, toe het my ma gesterwe. Ek was so teleurgestel, want ek meen, daar was help vir haar gewees, en hulle kon dit nie vir haar gegee nie. En jy weet, ons het teruggekom, terwyl ons daar binnenkom, toe, hulle vat ons deur, vir haar deur, want ek het geweet, sy het gesterwe nie, sy is op. Toe ons binnenkom, toe sê hulle net vir my ma sien nie daar nie. Ek weet, ek het so teleurgestel gevoel, want ek vat, daar was dan help. Ons het amper 6 ure gewag voor die ambulance gekom het, omdat daar geneem het na Jooste hospitaal toe. Is al wat ek net wil sê.
Whenever I go to the day hospital, I set that day aside. That's what I'm going to do, to look after my health. Coming from private health to public health was a vast different thing for me to do. But what I can say is that I'm very happy with the treatment I received. I've lost my father-in-law last week on Friday. He never wanted to go to the hospital. He never wanted to use the medication which the doctors gave him at the hospital. We cannot always blame the doctors. The thing, something between you and the doctor is a trust relationship. You have to speak to the doctor, tell him what is wrong. And you don't need to go only on the 6 month. If something happens in between, you have to go to the doctor.
There isn't doctors. What do you do? What do you do there?
They said I'm a lucky one to always hear them.
Yeah.
Thank you.
If you go and you go to the take the blood, you do all that. Yeah, they say you to the sister. You complain by the sister and says you have this ailment. She just give you something, or she says, okay, come next time, and then you never see a doctor. If you complain and you say that there is something wrong, especially diabetics. Diabetics have got a lot of problems that occur from time to time. And you just can't see the doctor. Now, I am going, on Monday I'm going, and I'm going to ask to see a doctor because I have a big problem.
If I don't get the proper assistance, I am going to phone the toll-free number for government to come intervene there. The other thing that I want to speak about is the wheelchair-bound people. The wheelchair-bound people are standing there. They don't assist the wheelchair-bound people. I'm also in a wheelchair, but I just walked up to the civic center because I'm not so far from there. We sit and wait and wait and wait, and we're not supposed to wait. The people that walk with the sticks and wheelchairs are not supposed to wait. We're supposed to, with any government facility, we are supposed to be helped first. Okay? The other thing is, there's a lady at the day hospital here. She will get your medication, but you must pay her a 10 rand and you go very quick in to get your tablets quicker. That is a big problem. Most of us are pensioners, disabled people. We doesn't have that kind of money to give away for free. You can't charge us. You can't charge us a 10 rand. She says to me, no, I must keep my mouth. I'm wheelchair bound. You're supposed to take our folders in and we're supposed to be helpers. She was just cross for me because I said the people are paying 10 rand to you. I don't care if I split the name of the person, but yes, that is what is happening. Thank you.
And because the day hospital couldn't give me those tablets. Because they've been giving me cortisone ointment all the time and it wasn't working. The infection was going up my leg. I went to Curtis Care and the sister gave me the referral letter and I went to Curtis Care. And I can thank the Almighty that I have been, last month was my last month and the period of the medication helped me. And she explained to me that the day hospital don't have that tablet. The other problem I have with collecting medication, I collect at Westridge. The last 6 months I had a problem, but that pharmacist, she really helped. For 2 months I had to come back 3 times to get my medication because it wasn't there. This month I had to get my medication, it wasn't there. Then she phoned me the afternoon to say, I'm on the list for the day hospital. So somewhere along the line, they missed out because I always tell them I collected Westridge. The other thing, don't take off Farmer Press. I don't have a problem. I am very lucky that the medication I get is helping me. Thank you.
A comparison within our substructure, which includes fairly big community health centres like Gugulethu CHC, like Hanover Park, Heiderveld, Crossroads, Dr. Abdurrahman in Athlone, Younger CHC in Samazabantu. At those facilities, the maximum number of patients in their chronic club environments tends to be at around about 6,000. So that would be less than a third of the patients that we deal with. At over 20,000, our chronic club population is by far the biggest in the metro, the biggest in the province as far as we know, and possibly one of the biggest in South Africa. We haven't depended so much on the availability of resources. Resources are relatively scarce in the public sector when it comes to additional resources. So it's not as though we can go and ask our department for extra money in order to improve the service we deliver. We've had to devise improved systems in order to address the patient load. So, for example, as many of our chronic club patients know by now, we restructured our reception service so that chronic club patients no longer have to wait in a reception queue. when they enter the facility in their allotted appointment time, which is a 2-hour time slot every day, either from 7 a.m. to 9 a.m. or from 9 a.m. to 11 a.m. or from 11 a.m. onwards, they can proceed directly to the service area without waiting in a pharmacy, in a reception queue. We've then restructured our club service so that all the services that the patients require are located in one centralized area, so that the patient doesn't have to move between different service areas in the facility. And then we've restructured our dispensing system so that the patient is issued their pre-packed medication at the time of their consultation, as long as they're in a stable condition. If they're in an unstable condition, then we may have to remove that patient temporarily from the club environment, and we may have to manage them in a different service area if we introduce new medication, or if there's some issue that needs to be managed more acutely. Then the patient might be removed from the chronic club for a temporary period of time until we can stabilize the patient and allow them to re-enter the club system. But if a patient is stable, they'll be issued medication pre-packed form as part of their club visit. They'll be given an appointment within the club environment so that they don't have to go back to reception and enter another queue. So generally, we have tried to create what we call a queueless system. There always are some degrees of queues because our time slots are filled with an allocated number of patients, and those patients tend to arrive at the same time. So we do have to manage that number of patients, but it's a fairly small number. It's usually in the region of about 60 or 70 patients per time slot, and obviously because it's a smaller number and because it's a small area of the facility, we can manage that queue in a much more productive way than we would have if the patient had joined a more general queue at reception. Unfortunately, that doesn't happen any longer. When we first started planning our new system of chronic disease management for the CDL patients, our total patient population at that stage, which was about 2 years back, was just under 17,000. In the middle of this year, it had grown to just under 20,000, and at the moment it's over 20,000. So we just see the ever-increasing number of patients with CDLs as being a big challenge. And we also recognize that our facility, even with improved systems, has a kind of a ceiling in terms of the capacity of patients that we can provide a service to. We've projected that our maximum capacity using the current system would be about 24,000 patients. So when that happens, we have to then devise an alternative system of delivering the service. And just generally on a day-to-day basis, our challenge is delivering a quality service to the large number of patients that we have to see on a daily basis. The Western Cape government, through its WOW program, WOW stands for the Western Cape on Wellness program, is actively screening and encouraging people to screen. The WOW program encourages wellness through healthy lifestyle activities, healthy eating activities, and also screening for the presence of chronic disease of lifestyle.
My name is Dr. Chibuzo Anaso. I'm the founder of AnasoDiabITiz and AnasoDiabITiz Foundation. Departments of Health and health funders have seen that most of their budget goes to dealing with chronic diseases, yet we're not getting the good result. The results are not getting better, but it seems to get worse as time goes on. So now we've tried to find the missing link in trying to get the missing link in trying to make sure that the budget that is spent on these diseases yield good results for the sake of the individual and for the sake of the economy of the country. So we've tried to look at the fact that we have few doctors and we have lots of patients, and we try to create efficiency so that the care providers can do much more for patients, and that's where technology comes in. And apart from seeing more patients, it helps us to look into the lives of the patient, because chronic disease of lifestyle is not just taking the medicine, but modifying their lifestyle so that we achieve the better result. So now we're able to use technology to engage more with patients and understand them. There's a two-way communication, really understand what the problem is. The mobile health solution, it's more of using mobile phones to create extra access to care. So that if you have a phone, irrespective of the type of phone, we want to use that to reach out to patients and give them standard care, irrespective of where they are. And in terms of chronic diseases, which involves a lot of monitoring, rather than coming in twice a year and then we try to see what happened throughout the year, using the mobile devices, we monitor more regularly so that we are able to make informed decisions early, preventing complications and giving our patients a better quality of life.